All right, earlier we aired a story about the president of Tanzania. John Magufuli is a known coronavirus skeptic. He's downplayed the danger of COVID-19, refusing to order any vaccines, even for the East African nation. Madagascar, Burundi, and Eritrean leaders have also not placed any orders. To discuss the impact of such misinformation on the fight against COVID-19, I'm joined now by Oksana Pyzik in London. She's a global health advisor and a lecturer at the UCL School of Pharmacy. Oksana, Tanzania's president isn't the only one, of course, to deny the existence of the pandemic or to downplay it. What position does this put these countries and the people that live in them in when something like this happens?
Well, it's the ultimate betrayal of their leaders in terms of that it is facilitating the deaths of their own people. We see that globally, 2.7 million people have died of COVID, and that's likely an underestimate. Mostly in these countries where we do see leaders pandering towards populism, where reporting is also not happening at sufficient levels. So when we look at the tragedy around this, it's that by downplaying the science or this willful disregard for the harm that it's causing, not only does it cost lives in those areas, but when we think about the broader context for the rest of the world, this also means that, for instance, in Brazil, where we have had almost very limited amount, if any, public health interventions throughout the pandemic. This is where one of the variants have emerged, where we saw an oxygen crisis with tanks being filled in neighboring Venezuela, and all of these aspects that will breed further potential variants that can cross into across international borders. We know that viruses are prone to mutate more when there are high levels of transmission. Again, all of these countries have that in common, and couple that with vaccine hesitancy, and it's just the perfect breeding ground.
So if these countries aren't testing for COVID and reporting cases and deaths, how can we even know what's happening within their borders in regards to the pandemic?
This is extremely difficult, particularly as some countries also have restrictions around media and reporting, and it's very difficult to get an accurate picture. So whatever we are hearing, we can almost certainly assume that it's much worse. But we, again, need to focus on being able to we even saw all of this even through the previous Trump administration in the US, where there was a significant promotion of misinformation. Globally, what can we do to try and support citizens is to put out fact-verified information that may be more widely available. In the UN, the WHO, they've been working on this, partnering with big companies such as Facebook, Twitter, to be able to label what is factually correct or not. And in some countries, this is less censored than in others. And that could be a good way for people to be able to get information outside of the area themselves. But it becomes almost impossible to protect yourself when there's such reckless abandon for human rights, for healthcare, and for essentially the again in Brazil, we've seen over the weeks an 18% rise in cases, ICU again filling up. The situation is just escalating, and in this instance, I think there has been some reliance on whether this is going to ease off throughout the summer due to vaccines. But it is so difficult for the rest of the world to be able to really get the levels of transmission down so that we are in a safer position. Because the more this carries on, the more vaccine resistant strains could potentially emerge. So far, we know that most of the vaccines we have to date do seem to give some level of protection against existing variants. But the more that these states promote this misinformation, they're also promoting the spread of the virus by consequence, the more likely that we could be in a position where we have to return to earlier protocols. And that's, again, extremely harmful to public health, but also just public trust.
Right, and you know, it really does affect the rest of the world too, as you said, because many of these countries aren't even ordering vaccines, and we know the WHO has regularly said that everyone needs to have access to a vaccine. So if these people in these countries don't even have access to a vaccine, what does that mean as far as tackling the pandemic and the longevity of this virus sticking around?
Well, exactly. The longer that countries go without vaccinating their populations, the longer that this pandemic, by its definition, it's global, will carry on. And that death toll will just continue to rise. Uh, Again, why does this concern us? It means that it won't be, when we look at the global market, the way that the world operates, it's just going to be next to, unless we completely seal ourselves off from these hot zones, again, which many countries are not willing to do for economic reasons, we're putting our own populations at risk for that reason. So there really has to come, we have to come to a consensus here about what is the moral and a scientifically correct way forward. And it's especially, I think, insulting to countries that are trying to adhere to public health advice, but may not have resources, may not have vaccines. This type of refuting of all that, I think, is just a slap in the face.
All right, some really excellent points in there. Thank you so much, Oksana Pyzik, joining us from London.